In this video today, I'll be discussing the negative effects that surgery and anesthesia can have on your brain and your overall level of functioning. So if you or a loved one is about to have surgery, I encourage you to watch this video to find out what you can do about it. Have you ever heard stories of patients who go in to have surgery and when they come out, they're never the same? That's what this video is about. Okay, here's a little scenario. We have a patient who goes in to have surgery. Everything goes smoothly without any complications. Then the patient is wheeled to the recovery room and all hell breaks loose. This patient starts to exhibit signs and symptoms of delirium. So what does delirium look like? Well, first of all, this patient's confused, sometimes to the point where he may not even know why he's in a hospital gown or why he's lying on a hospital bed. He's anxious and he's also combative, sometimes to the point where he has to be restrained. So what usually happens to a patient like this in this situation? Chances are overwhelmingly that in about half an hour, maybe an hour or so, he'll go back to his baseline and be okay. But sometimes this patient will be sent home and he is not okay. He may start exhibiting some slow, subtle decline in his mental capabilities. Sometimes this can last for weeks, for months. Sometimes this can last forever. This condition does have a name. It's called perioperative cognitive decline. And the way this works is from right after surgery to 1 year after surgery, this is what it's called if you're still having cognitive issues. But once you hit the 1 year mark, you got a whole new diagnosis. They drop any mention of surgery and you are said to have neurodegenerative disorder. Not good. This is not going to turn out well. So what is it that puts us at risk for this? Well, there are three things. The first is if you already have a pre-existing issue going in, if you already have a diagnosis of dementia, or if you already have some memory issues. Next, the older you are, the more prone you are to having this. Kind of makes sense, right? And lastly, surprisingly, is your level of education. It's been found that if you have a lower level of education, chances of having this are a little bit higher. Go figure. So let's talk about the surgery itself. What is it about the surgery that's going to put us at higher risk? Number one is the type of surgery. Is it a major surgery? Is it a minor surgery? Major surgeries carry a much higher potential risk, obviously. Some examples of major surgeries include total hip replacement, all brain surgeries, most all cardiac surgeries. Other examples include transplant surgeries, hysterectomies, and bariatric surgeries. Next, is it an emergency surgery where we rush to the OR because we had a ruptured appendix? These are also full of potential problems. Lastly, is it a prolonged surgery? Did it last longer than expected? Or is it just a long surgery? The longer we're under, obviously, the longer we're being cut on and the more potential problems we can have. All right, so let's talk about the flip side of surgery, and that's anesthesia. Who's running the gas? There are two main things that we need to know about anesthesia, and that is, number one, how long are we under? And number two, and more importantly, how deeply are we under anesthesia? There is a direct connection between how deeply we've been placed under anesthesia and our chances of having post-operative delirium. And this is the main point of this video. There is a direct connection between post-operative delirium and perioperative cognitive decline. And even more importantly, there's a direct connection between perioperative cognitive decline and dementia. That's why I made this video. I don't want you to go down this road. Also, deeper anesthesia is going to make us more prone to having low blood pressure during surgery. And this could potentially compromise blood flow to the brain. Not good. Something we definitely don't want. Let's move to post-op. So what can we do as patients to help benefit our cause? What can we do to help prevent post-op delirium? All right, so picture yourself. You've just had surgery. You've just been wheeled into the recovery room and you're just about to wake up. You're groggy as heck. You wake up and now what? What can you do to help prevent any post-operative complications? Well, there are 7 measures you can take. At the top of the list is pain control. You have to have adequate pain control. This is a biggie. You cannot be left in a post-op state without having adequate pain control. This is going to make you much more prone to having delirium. Number 2 on the list is medications. This kind of conflicts with pain control. We have to have adequate pain control. However, some of these medications can make you more prone to delirium. So it's kind of a juggling act, and this is where your physicians are going to earn their money, to keep you comfortable, but not to snow you under. So the elephant in the room here are opioids. These are things like morphine, Dilaudid, hydromorphone, oxycodone, hydrocodone, Demerol. These are medications that are going to make you more prone to being delirious. But we have to have our pain adequately treated. Now, there are some medications out there which are referred to as opioid-sparing medications. These are given to you to help control your pain, but also with the hope that you won't have to take as much in the way of opioids. And with regards to these opioid-sparing medications, there is one particular medication, goes by the name of pregabalin, also known as Lyrica. Some of you probably take this medication or have at least heard of it. This medication is very well known to cause post-operative delirium. Stay away from this one if you can. The other big class of medications, benzodiazepines, we all know about these. These are medications like Ativan, Xanax, Valium. Unless you have a damn good reason to take these medications, don't. And then there are some other medications which might surprise you. Number one is Benadryl. Yes, Benadryl. Number two, scopolamine. Scopolamine is an over-the-counter medication that is sometimes used to help prevent post-operative nausea and vomiting. And number three is Reglan. This is a pretty common medication that's used in the hospital, also for nausea and vomiting. If at all possible, stay away from these medications. Okay, next on the list, your senses, your eyes, your ears. So if you wear glasses and can't see without them, put them on as soon as you wake up. Also, if you need hearing aids, if you wear hearing aids, put them in as soon as you wake up. Also, if you wear dentures, put these in too. Another biggie is immobilization. If you can get up after surgery, if you don't have any restrictions, and if you feel comfortable and safe enough to ambulate, get up and walk. Next is sleep deprivation. The hospital's the worst place in the world to get sleep. You got bells and whistles going off. You got people coming in, poking on you, prodding you, taking your vital signs, asking you dumb questions. You're not going to get good sleep in the hospital. Make provisions for this. One thing that you might want to do is to sit down with your surgeon beforehand and discuss with him or her about your concerns with being sleep deprived after surgery. Sometimes they can make provisions for this. Yeah, sometimes they actually can. Next on the list is cognitive stimulation. So if your loved ones are allowed back in the recovery room, this is great. They can help you out with cognitive stimulation, reassurance, and reorientation. They can tell you where you are, what just happened, and what's gonna happen. Hey, you just had surgery. Hey, you're going up to room 232. Hey, you're going to be discharged in the morning. Also, you can get on your phone, maybe FaceTime somebody, get on your iPad, and stay stimulated cognitively. We want to stay out of the realm of delirium. Next on the list is dehydration. So, most physicians are good about keeping us hydrated, especially after surgery. However, if we have had fever, vomiting, diarrhea, sometimes these fluid losses can be hard to keep up with. So we might need a bump up in our IV fluid rate. Make sure somebody's aware of this. Okay, next on the list are lab abnormalities. A couple of the biggies would be a high sodium or a low sodium. Also a high glucose or a low glucose blood sugar. Those are two of the main ones that we need to watch out for, especially post-operatively. We need to make sure somebody's keeping an eye on these. So there you have 7 things that you can do post-operatively to help your cause so that we don't get post-op delirium. I hope that this video was helpful in helping you come up with a game plan as far as covering your bases prior to having surgery. If anybody out there has any recommendations on other things that we can do post-operatively to help prevent delirium, please leave a comment below. Or if you have any other experiences post-operatively that you want to share with us, feel free to share. So until next time, stay safe.